Hello wonderful students, myself Dr. Maddineni Srinivas, your dermatology faculty from Bharat. So in this video we are going to cover important theory question IRIS, which stands for Immune Reconstitution Inflammatory Syndrome, IRIS. So what is this IRIS? What is the concept? To understand this, first you should understand what is the scenario here. Just imagine a patient who is a HIV patient who is coming for the treatment. So what are we going to start? Antiretroviral therapy will be started. So what are the possibilities that before the treatment, the patient of the HIV may be having some pathogens, opportunistic infections, some bacteria, like for example, Mycobacterium tuberculosis, Pneumocystis cerevisiae, and other bacteria, other virus, other parasites. Okay, so something is there inside the body of the patient, and we before the starting of the treatment, there is going to be very poor host immunity. Okay, this is the before picture. After the initiation of the antiretroviral therapy, the pathogens are still present in the body, but then what happens? The immunity is going to be boosted. CD4 count is going to improve. Because of this increase or improvement in the immunity, what will happen? There is going to be inflammation in the body. The immunity is not going to be silent. It is going to kill the HIV virus, and also it is going to kill the other pathogens. And because of this, in this process, there is going to be a lot of inflammation. There is going to be a lot of inflammation which will happen. So now you will understand the meaning of the name or the definition of the name very simply. So there is going to be immune reconstitution. What does the reconstitution mean? It is a very costly word to simply say that improvement in the immunity. So immunity is improving, because of which there's going to be inflammation. Because of the inflammation, there are going to be some signs and symptoms which will be seen in the patient. So this is called as a syndrome. So immune reconstitution inflammatory syndrome. I hope now you have understood the definition part. With this, I am very sure that you can easily write down whatever is the topic which I am going to now tell to you. Already you have understood the simple funda behind the IRS. Now you will very easily understand the definition, pathogenesis, and the clinical features and the treatment part. So now let us look at the actual definition. So this is a condition where the pre-existing infections, like I have told you, Mycobacterium tuberculosis or Pneumocystis cerevisiae, they are going to worsen. They are going to worsen due to the exaggerated immune response. The immunity is improving, so there is going to be immune response after starting the antiretroviral therapy in the HIV patients. And because we give ART to HIV patient, what do we expect? That there is going to be improvement in the clinical features. But because there is a worsening instead of getting better, so we call it as paradoxical worsening. Paradoxical worsening. And remember, this can occur in up to 10 to 30% of the patients after starting the ART. So what is a pathogenesis? The immune function rapidly improves after initiation of the ART. It is going to kill the HIV virus, but along with that, it is also going to cause inflammation, because it is trying to kill the pre-existing other infections. And this is due to the imbalance between the effector and the T regulator cells, and also macrophages and the NK cells are also associated, contributing to the pathogenesis of virus. So having a opportunistic infection at the time of the ART initiation is the major key risk factor, obviously. And like I have told you, Mycobacterium tuberculosis is the most common cause of the iris, along with other bacteria, virus, fungi, and parasites. Okay. And most importantly, the challenge which we face after the ART is initiated is whether this is due to the iris or whether it is due to the treatment failure or the resistance to the ART medication. So this differentiation is very important, and so this requires a proper thorough clinical and also microbiological assessment and evaluation. So what will be the clinical features of this iris? There is going to be worsening or new clinical features will be seen, and also new radiological signs can also occur. So if it is due to tuberculosis, what can happen? There can be worsening of the pulmonary or extrapulmonary tuberculosis symptoms, like for example, patient may be having fever suddenly after the ART is initiated, and there is going to be lymph node enlargement, and there can be even pus collection. All this is happening because the immunity is trying to kill the MTB bacilli. Chest X-ray may show new infiltrates, and there can be mediastinal lymphadenopathy, and there can be worsening pleural and pericardial effusion. CNS TB, it is going to associated with worsening headache and also altered mental status. All of this due to the thanks to the inflammation which is happening. Pneumocystis jirovecii iris. So this again worsening of the pulmonary symptoms, and also patients will be having high fever, and there will be lung infiltrates on chest X-ray. So before the treatment part, simple funda, how to prevent this? Very, very simple. The patient may be having opportunistic infection. Diagnose that opportunistic infection and treat the opportunistic infection first. So opportunistic infection should be treated first. HIV, TB co-infection if a patient is having. Okay, then what we should do, what the World Health Organization recommends, treat the bloody TB first, so that there are no bacilli, and then after that start the ART. 2 to 4 weeks, that is after 1 month of the treatment of TB, start the ART. Then there will not be any iris, there will not be any iris. And also ART should be initiated before the severe immunodeficiency. So early diagnosis and treatment of the HIV is also important. Okay, so I hope now you have understood from the prevention what is the funda behind the iris. Okay, so now coming to the treatment part. So we have missed the diagnosis of a TB in a patient. We have given the ART. Now it is worsening. What we should do now? So we have to treat the opportunistic infection, whatever it is present. So we should start ATT in the patient. And if it is a mild iris, NSAID can be sufficient. If it is a severe, we have to start the patient on anti-inflammatory corticosteroids. But remember, ART should be continued because the virus is going to be killed and the immunity is going to be improved. So ART should be improved, except for some conditions where there is a life-threatening iris happening. What is the prognosis? Yes, it is a self-limiting condition, and severe cases, morbidity and mortality may occur due to the acute respiratory distress syndrome or the CNS involvement. Because of these, there can be morbidity and mortality. Otherwise, this is a self-limiting condition. Okay, so I hope this video was helpful. If it was helpful, please do hit that like button, and if you're having any doubt, you can put your doubts in the comment section. Thank you so much for watching this video till this point. Do subscribe to this channel and also share this among your friends. And happy learning. Till we will meet in the next video. Sarvam Sri Krishna Arpanam Sarvejana Sukhino Bhavantu. Happy learning. Bye bye.